Finishing it when they're doing
Yeah. That's what, yeah, I'm like,
You're the director. You're the director. Oh, please go. Is it okay with that?
Yes. 1, 2.
I'm not sure.
Oh.
Should we do like, but can we do like packages that were so spread out? Can we got 2 layers to bring everybody in?
Should I go on that side, maybe? Okay. And then what do you guys do?
Yeah. I'll go down there.
I'll be with Holly.
One, two, three. I'll do one more.
Yes.
1, 2, 3.
I'll just eat it in the picture.
No, you don't. I'm doing all I'm seeing currently.
Oh, because of the key ones. I'm just getting false. Yes. 1, 2, and
but I graduated in 2020.
which one of everything over
Yes. So it's kind of like after school. Look. Yeah. And then there's
No, that's my next one.
You were here. Right, so like if
How about right here?
So.
I wanted you to run with them. You want to tell me? I didn't want to be up against.
Yeah. So we just do. And for social media, I did this way. Yeah. Yeah.
One, two.
Thank you. Thank you. Let's eat now. Very good.
I got you
Oh. Yes. Yeah, you have to do
Yes. I'm doing a panel, and then Shauna and Holly, and you. Claire, you want to do it?
Claire.
I can't put her on the spot like that.
Yeah.
I can put you on the spot like that, but I can't put her on the spot like that. Yeah, did you like? Okay, I can have every SLC like it's really cool to see. Yes. I'll make sure I trace off of But yeah, I know one of my and that's how she like I don't know. We saw for first I don't know. But I they were just and so I called me back because he told my but also so I'm gonna do yeah. So I think that's probably and it's actually because I think that's one of the biggest issues we have is like getting them to pay out claims, especially when we have an HR change.
Giving it like
And then you have to put in like what's it called? Sometimes your claim expires. Yeah. So like
like at the time I'm so much like organized.
And in college, I was walking like over to the park and stuff like that. So I'm like, I'm gonna do the adult version of that, which is getting everyone who's sustainably like dental, whether they're nurses, or everyone. And I feel like the louder we are, the more we it's just also time. Oh, yes.
I know. There are a lot of like, not all, but there's some. Stop doing all schools.
We definitely have this one. I feel like the way I'm saying it right,
And of course, how do we regulate well? Just train up.
Yeah, they don't get like hot enough, but also because they have the non-stick component, you kind of need to warm back up instead of having a warm, you'll just kind of
So I have.
How did you eat? Did you get the food?
No, I don't get it.
Yeah, kind of.
right now they're gonna train you. I don't know why you call it all for me, it's more my parents, so yeah.
So it's a feedback.
My dad was really upset with me for leaving community. Really? Yeah, he works in. Like, you know, when you have like these but in a good way. And when I was starting off in college and everything, there's so many things, and so I would just like go and really, yeah, I have a big personality.
I love it.
I like different.
I do too. Oh, yeah. That's
I mean, it really literally I always joke about parents don't like these whales. I always joke that my nails get to do like this, because it's like that.
Yeah.
Engineer. It's perfect, like, all the no,
She made it.
a lot of time.
I think it would make more sense for us to be
Especially when I
Yeah. Yeah.
Don't worry, it's understanding.
I can like right there. I can do this.
We face each other.
Yes, I would like to teach you better.
Okay, so not like-
And so every school says I gotta see make sure it's size. And Western yeah, and you guys said I'm yeah, you and I were right. Put me in the middle of this thing. Love it. Right. What do I do in my spare time? Okay. I know this is gonna surprise you. But okay, two things I like to do. But I'm a fish theater. So I'm very involved in my community there. And I love to sing on stage. I love to entertain people. And yes. My favorite thing ever is like, and I love to do like this when I'm on stage as well. When I'm on stage and I hear the audience, I get the biggest high. I mean, like, it just makes so like, I love it just so much. I can't get enough of it. And so I'm actually in a production right now, my Christmas. And you would think, but it's not. It's actually working. Are you leaving? No, take my card because I told you what, if you ever want to outreach and see what's all about, please let me know. And you can totally come with us. We're located in southeast Minnesota, so we're like, but we go to like, Wasika, Jigsaw, I mean, we're kind of like all over southeast Minnesota. But if you were like wanting to see, like, boots on the ground, what are you doing? You're very welcome to come and hear friends.
Yeah.
Yeah, and you might watch it because I might put gloves on you, which you are.
I'm gonna be a TA for a day. Unlicensed, but. Wait, let me just go real quick. I had a question for you. So.
We're still.
Sure. I don't think I heard that.
Yeah. Comes out of your mouth.
I was like, I don't know if I really want to do that. Stop.
Yeah.
I'll tell you what,
Yeah, absolutely.
yeah, this looks like, so,
Yeah. No, but that, yeah, absolutely.
But, you know, she's like, again,
Well, I mean, my name is.
she makes it meetings.
I don't use that, but.
Why would?
Not to.
It is.
I never really.
No, you are totally fine. You're not just looking for that. Yeah. So we have a. Yeah. Anyway, so that's what I like to do at my spare time. And then when I'm not doing that, what I do, my favorite place ever in the world is on my deck. That's my and my cat on my lap. That's my favorite. Because I'm gonna eat a pound wackadoodle this time to cover. She's just right here in the package. You're what? Ours is a rescue dog. And it's just kind of like. But that's okay. She has a little love and happiness. What kind of dog?
Yeah, I don't know.
Oh, good for you. Because that's a population, I guess. Yeah. We just need to do this.
I was, I didn't.
Yeah. It is. My kids love that when they were That'd be a big, right, that's a lot, it's a lot. Oh, wow.
Yeah.
Yeah, I was like, would it make you happy? That's all that matters, right? How do you learn that?
Then you were going to help us. Yeah. Was she a part of that?
No.
Good. What is this? I don't know, I look into that.
It's really great. And I think there were some questions.
But I was, yeah, well, my husband and I are proud of doing this. We're brand new to this. We love to do the year together. Everything is really big, that's what it is. And my kids are really happy. Boys everything she was doing. And you guys, this would be our I'm so what? Oh. Yeah. And she's not happy. And she's reflecting that. Yeah. Yeah.
I'm so sorry. There's, cheap. So it's not like
She just did a.
yeah. There's like a bunch of
different.
Yeah.
Are you from St. Paul?
Yeah.
Oh, so you know all the places to go.
I saw it in the pages. Yeah, I'm pretty sure.
Yeah, so all of us both.
Oh, yeah. Oh, okay. But I know it's on this one. I didn't write it.
That's fun. Well, yeah, it's perfect. Just totally get it. Keep doing what you're doing. Keep doing what you're doing. Well, happy anniversary to them. You don't even have you don't have games. I love that you added that thing.
Yeah.
Oh, so then like what do you call them so that you like that's
Hey, hi, I'm Paula. Hey, nice to meet you. Would you like to get me juice? Please do. I have a lot. Thank you. And then yeah, we can go over the water. Okay. And then
I don't know, they don't know.
I'm like,
Yeah.
Thank you.
She wanted to sign something. She asked me to sign something.
The one that you signed was that one. You signed it already. I need to sign it on my computer.
IA form?
Yeah,
So I didn't have to do it?
you signed it already.
Yeah, I thought like she said.
But she just sent it to us saying that she fixed everything for us to just verify. I don't know.
I verified you.
I'm just, I think it's basically exciting.
It's almost like you heard.
No, I did before Grace. Yes, thank you. Yes. No, this is really very, but it's not very much remembering that. So, but I do, we get a lot of funding, you know, from our partner, with them quite a bit, we get a lot of their, patient education resources and everything, so I just, there's a two ways, so you're
Let me get your chair.
So excited, we're gonna yeah.
So there is a new thing where it's like, they'll send you a really bad
Right.
but there's enough people that actually want it, so they have to get a purpose that also be awkward, like getting our thing and all that. It's really bad. One of my friends decided to see how long that like rabbit trail was. Like these are and so it got to a point where she was like, you know, I don't know how to I can't cash out. It's that so much
Yes. For the somebody's to do, get into your account, come here so that you can fix it, and then you click on it, and then it's like, snap, print out everything, took out.
Yeah.
And
I was on the student about the time as a kid. And so it's like I was able to like make actually already like once my friends were like make sure it's something. And now it's just browser now it doesn't have it. My friend was using internet for and I was like, it is 2017. That's part of their I know I don't like to do that.
oh, that's nice.
Yeah, it's Safari.
Yeah.
Oh my gosh, yeah, she always This one is the one that oh I got.
I love it.
She has like a little like mask on her face, so she looks like the let me see the dog emoji. It's a weird, it's a really genetic trait, really. Because I know a lot of healers that would have it. She's I don't know if she's still mixed or what, to say that for a while. But I love it. She's always had that.
That's beautiful.
But I think it is. She's a good I know. There's a couple of specific other ones, like bees and yeah, I know exactly. And I guess that, yes.
And then, yeah, I was like, it's like, oh, no. But,
Yeah. So always like doing something interesting. I'm like, Mom, so what are you doing? She's like, well, I already have clothes and shape and
well, then you might as well. Because you're happy.
I think for her birthday, she doesn't want gifts. She's like, I just want money for the specific type of cat. She wants white cat and then she likes to go up.
So then we have, look at my cat.
My little daughter, or she'll sometimes land on her belly, and if you start petting her, she just freezes.
My dog's just like, oh.
That's basically part of the
Yeah.
Almost like it's 5 days or like if I brought her and so my other dog would just yeah. And so there's I definitely did let my kids contact each other. But
That's the brand.
that one. I guess he's a dude now.
Everything is a doodle. She's a wackadoodle. Be more this was okay, good. He's a like, no, her.
So when I was at my old job, one thing I used to do to the point where my staff was testing on like is I had asked them for every hour.
Oh, yeah.
And so every time I was like, go and check on those things, what it is, so reads and it started. Yeah. And so, like, I am staff person, but I would put a feeling for God, so my dogs know this. So you just press a button on your phone and then it throws a treat your link, and then they just.
They hear your voice. You're like, oh, you're being a good girl.
It has like a little bit of stuff. So you can see how they get one. It was definitely a school fight because they were also
Oh, yeah.
I love it.
Well, yeah, let's see what you guys say.
I mean, so I see like
Oh.
so we just not a priority for her. Yeah. Right now. I'm just doing it. Oh, no. And then this is, right, this is part of she blends into like college. Yeah. So one time I didn't realize that she didn't slip down, which obviously was my fault. And so I got wow.
Because you don't know,
I
you
just know I
can't
can't
see
see
it.
it. Yeah. And so I was
Oh, no. Yeah, especially she has it. Yes. Yep.
Yeah, then she was I'm just lucky now she's not. So it took like 5 years. We went down the apartment because we were like it was January. So shoveling snow was not gonna happen to me. Any of that. I was like, I just want that. Yeah, that means.
Yeah.
They did all this, like,
Welcome.
I had to choose my like entire responsibility because it worked well like that.
Yeah.
I'll try very. Yeah. But here it's like chapped, especially right here. And I, in my mom was like, I was like, oh. Sorry, I just don't know what you're eating. Oh my God. I'm okay.
Yeah, I was just gonna say, I think the topics that you're most It's like that.
My parents are gonna be celebrating their years on Sunday. Do you have a message for them? You said good for you. For 30 years. My dad is. Oh, I think it's
Oh, wow. That's a big one.
Sharon Oswald from.
Good for her. Good for her. I told her that time. So she was 7. So she was 7. I heard her say
Yeah. Oh, really?
Yeah.
She was. So, and I oh, this question. Very like, covered.
Thank you.
At least it was fun. Yeah. I'm like, that's what we were expecting. I'm like, things that go not the way I. The dates that are
waiting to get us to do it. Yep. This is where I'm starting to this.
And
Yes, but I
think it's just like.
Yeah.
They just agree. Yes.
That one?
Yeah.
That was when we actually had.
And there probably are.
Yeah.
It's just like all really fast. And it's like, God, maybe.
Yeah, that's a lot like my biggest daughter. She's pretty much that. And she would just stay up all night doing her homework to make sure that it's perfect. And she went to college for her senior. She's getting straight A's. From what I understand. Just a story. Yeah, she had it. And you need to just, you are, no one hurting yourself. Because you need to just, you know, I mean, but I mean, I didn't know her and I would be working so hard. She's stressed herself out. Yeah. Yeah.
Yes, so here I get started with our piano. After that, I think we're good. I'm basically gonna explain some, we're putting up the RFP out. We have a RFP for the migration station grant too. In case that they know any childcare centers that would be interested, we have kids under 6 and also mentioning a really cool quality award system. Me and her, she have to work on that. Good question. Yeah, it's like, oh my God, good job. Here's a paper certificate. No, actually, it doesn't come with a frame. You just get it. Not even card stock.
Oh my gosh! I want to be like that.
Yeah, I'll make it fun too. Or
It's made for putting food. Okay. Or when you were looking at right? So much more healthy.
I'm excited to what we can do. Yeah. So you go through Bluetooth.
Yeah, that's what it's like. I'm still gonna graduate. Yeah, it's okay. Yeah, as long as you're passing. And I did really good at that. You know, like she's like a further line, just like.
I was also gonna tell you guys, I got pictures of college. I called my mom. I made their check.
Like my daughter, yes.
Well, I wasn't good at them. Yeah, I was still am. But now I can count numbers of teeth. Do you want to switch that?
But I think so. Shauna's just gonna do a little.
Tell me what you want me to do and do that.
Oh no, it's okay. I got it. Ashley, could you go over there and then do you know how to, yeah.
Which one is that?
It's underneath the white sheet. Yeah. Oh. It goes down pretty slowly.
I'm gonna have a call. I'll be back.
Oh.
About
Yes. Yes.
She's back.
Okay.
I am.
Sheila, thank you so much for offering to help me with like that dental shortage. Yeah. So I know I think where it's at right now, someone from our county sent a message to Brenda Flatham. So is she the person that would be kind of that? Okay.
So I figured that out. All right, everybody.
Yeah.
I am so sorry. I hate to interrupt all the really exciting conversations we're having. So we're gonna. Sorry.
We're talking, sorry.
No, honestly, I talk all the time. So we're gonna go ahead and get started. I wanted to have Shauna Headland here to talk more about the Minnesota School-Based Health Alliance, and then from there we're gonna go into a panel-based discussion, and we can ask questions. I have some that are already prepared, but of course, everyone has their own things that they're interested in too. But our panel will consist of Shauna, Holly, and Frashida. Because she likes having front and center, right?
Okay, yes, Angela.
But yeah, I'll go ahead and do the cookie for you.
Okay.
Yes. Oh, let me. Hi. Okay. And also, if you want to stop the door right now, or is this for? Yeah, let's try to do the presentation.
Okay.
Trying to figure out where to stand and then have a. Okay, so, I'm Donna Hedlund, I'm the executive director of the Minnesota School-Based Health Alliance. We've been a nonprofit providing technical assistance to school-based health center development. Folks like that.
This is so good, right? That shows it.
For about 2
Everybody's
years.
like in that
We
presentation.
got
I've never had these
um,
topics before.
on COVID funding in response to the precipitous needs of young people and students today and their losses during healthcare. Before that time, we had been a alliance of leaders in school-based healthcare.
Is this recorded right now?
So the alliance was started probably a decade before that from people that were working in a coalition with one another. This year, we're celebrating 50 years of school-based health centers in Minnesota. They started in 1973 in St. Paul. And in that time, the growth rate was about 2%. We started the alliance 2 years ago. Just this June, we passed legislation that funds a Department of Health program office for school-based health centers, as well as part of the budget for the alliance, so that we can work together to provide technical assistance to school-based health centers in that, with the intention of expanding that throughout the state, particularly in rural Minnesota. So that's going well. From 1973 to 2 years ago, the growth rate of school-based health centers was 2%.
Now regular rate is about 59%. So very exciting changes happening. Do you mind, can I advance it or? Let's,
Rashida, could you? It's on your screen.
okay. So we now have it in state law, the definition of school-based health centers. I don't want to take too much of our time today, but so I'll just be mindful. And as you can see, the characteristics are it's in or near a school. It serves students first, sometimes serves the community too. That's ideal. It ensures equity. That is written into the definition, and we love that. And it eases access. And I was thinking about this recently because we think of it as in terms of easing access to care that helps kids learn. But I like this part too, that we're helping communities to thrive, because there's a purpose to kids being in school, right? It's because we're helping them along their way in adulthood. We're helping them with developing wealth. We're helping them with developing passions and a potential career, relationships, and a place in their community. And what we see in Minnesota is that there are disparities in outcomes in all of these areas, literally from birth to death. And so this is just one intervention with students when they're a captive audience to provide them healthcare in the hope of disrupting those disparities across the entire lifespan. So it's about that helping them learn in school, but it's also about their whole life. Okay. Thank you for.
Next slide.
I'm sorry for being in this position. Thank you so much for.
You can also do this.
There we go. Yeah. So this is what we call our logic model for school-based health centers, and the areas of focus, the ideal multidisciplinary team. And this has changed a lot over time. I think years ago, they were primarily providing medical care. After the pandemic, what we are seeing is that children's primary needs are dental care access and mental health care. So things are definitely changing. Okay, and I can give this to you all to look at more in depth later. Sure. And again, this is a strong model for student equity. And I think the most important thing to see here is how they are embedded in schools. So we're working hand in hand in school-based health centers with the supports that are already at the schools. And with the programs, there are a lot of dental programs like Sealants, Children's Dental Health Services already in place in schools. And so school-based health centers are helping to augment that which is already there. And also working with families. School-based health centers are a huge benefit to families because we have kids that are in school, we have parents that are at work. And when you can provide care on consent by those parents and figure out a way to inform them and involve them in that care, then they can stay at work and the kids can stay in school. There's theoretical basis. We talked a little bit about the lifespan, the whole school environment, the whole community, and the whole child. This is the CDC's WISC basis or WISC theory, and this is also a basic theoretical theoretical model for why school-based health centers work. And again, I just wanted to highlight that school-based health centers work together with school nurses. Right now, nearly every new emerging school-based health center that we're working with across the state of Minnesota, that program, that initiative was brought to us by their school nurse. So school nurses are looking for ways to serve their students more deeply. And this is one of those available options. There are core competencies. This is from the National Alliance, and there are 7 of them. Access, we kind of went over these when we looked at our state definition that encapsulates some of these. We would like to have access, a student focus, the same high quality care standards that we expect in any ambulatory care center, a collaborative relationship with the schools in providing for their student wellness, and coordinating those systems from the state health department, Department of Education, all the way down to the local school board. And of course, sound business measures. That's just margin equals mission, that we want these to be provided for all students. And that is a costly endeavor because not all students are insured. And so when we can focus on their sustainability and make sure they have a sound business practice, then we just know we get to continue to do that good work. Okay. If you've seen one, you've seen one. They are all very different. The largest one in Minnesota is about 2,000 square feet. The smallest one in Minnesota is literally under 200 square feet. So we're talking broom closets being changed into school-based health centers. And newly remodeled large schools that have a portion of the school that becomes clinically focused. And this is just taking a look at some characteristics we know of the students that are served by school-based health centers in Minnesota right now, and looking specifically at Health Start, which is the oldest school-based health system in Minnesota. Actually, it's not only the oldest school-based health system in Minnesota, it's the oldest one in the US, which is interesting. It started in St. Paul, and they're providing over 25,000 visits a year for about 4,000 students. And they're providing for about 25% of their student population in those school-based health centers. And nothing here is probably surprising to you. Mental health requests have been increasing and increasing and increasing. Immigration continues to be increasing in most of the school-based health, or most of the programs and most of the school districts where there's a desire to start a program. Each patient is seen an average of 6 times per year, which is a lot higher than a primary pediatric care in a primary care setting. Whether we want to see them once a year. We're happy you can see them once a year. And let me know if you have any questions as we go here. Just want to be mindful of time. Okay. Look at the next one. This is a snapshot of Minneapolis clinics. Health Start is in St. Paul. Minneapolis Clinics is run by their city health department. And what I think is really interesting here is the percentage of students who say, if I hadn't come here, I'm not sure where I would have gone. And if you combine that with students who say, I know I wouldn't have gone anywhere else, this is my only option, then you can see that there is a high percent of kids who just don't know where or how to access the care that they identify themselves as needing. So I think what this goes to show is that school-based health centers are appropriate in schools because kids are learning about themselves, and we want them to graduate learning how to adult. And that includes this very complicated healthcare system that we have, and it gives them an opportunity to understand that landscape a lot better. So you can see in the Midwest, we do not have a lot of school-based health centers. In fact, the one that shows the markers in Wisconsin are actually mistakes. There are no school-based health centers in Wisconsin. And we're the only alliance between North Dakota, South Dakota, Iowa, and Wisconsin. And so we're trying to work a lot with those states as well. So if your programs intersect with other states, that's an opportunity for us to work together too. And, oh, actually, can you go back one? You know what, actually, I don't think that links us to the state map, but I think what I'll just say is that the majority of school-based clinics right now are still in the metro. And then we have a few developing outside of the metro that we're really working hard to advance. But it really has been a metro phenomenon for 50 years.
Yeah.
I think we already did this one. I must have that in our, okay. So this tells you a little bit about our alliance and what we do. I'm very excited to say here that we have been working, actually, I thought it was somewhere on this slide, but we do work very closely with a lot of coalitions and coalitions in mental health, coalitions in dental health or oral health. And coalitions supporting initiatives that are education oriented and health oriented. And the activities that we do, we have a community of practice. It's right now, we're just new, we've only been on the scene for 2 years. So our community of practice is open to anyone who's interested in school-based healthcare. Right now it's about 50 people strong. But if you're interested, I can add your name to that. We meet about once a month on different topics. We are allies for schools and for sponsoring healthcare organizations. We are here to provide technical assistance largely, and we are collecting data and evaluating data across SBCs to understand what the impacts are on those that we serve. And we champion communities by increasing access to care. That's the bottom line of what we do. And this just gives you an idea. Oh, here, this is what I was looking for. This gives you an idea of who we're working with. And we are, since we're new, this is part of what we're constantly trying to advance of who do we have mission alignment with? Who can we better support? Who is interested in working more deeply with schools that we can create partnerships with as well. It doesn't say that here, but MINAC is the Minnesota Association of Community Health Centers. So those are our federally qualified community health centers. Just a few interesting further points about school-based healthcare. I think one aspect of this that we haven't talked about is the cost savings, and that what we see in states that have really robust school-based health programs is that their Medicaid costs are significantly lower. And that's because the dramatic reduction of students not only going to ERs, but needing ERs, right? So that they go from, I think a great example is they go from having a toothache that's persistent for years to having, when it's untreated, a reason to go to an ER for care. And then if we can mitigate that while they're in school, then we're also reducing those costs to the state. And just some resources, and I'll be sure that you all have access to this and can check those out a little bit better.
Yeah.
Would you mind if I sent this to
Yeah, that'd be
everybody?
great.
Okay,
Yeah.
perfect.
Yeah,
Yeah, and so, does
have
anybody
any questions?
have
And then after that, we can get started with our panel.
panel?
So you may have already said this, but like, who are the people who are starting these health centers in the schools? And it'd be nice with a variety of people. Yeah, it's a very, it's strangely only a variety. We actually don't have any duplications in Minnesota. We have Minneapolis Public Health, so that's a local public health operation. We have Park Nicollet Foundation, so that's a health foundation model. Minnesota Community Care, North Point, and Open Door Community Health Centers operate school-based health centers at this time. And we have a private community clinic in Ortonville, Minnesota. And likewise, a private enterprise, a community clinic called Rise Up, that is in a charter school in White Bear Schools. And one more and I love this model, Minnesota State, their nursing school provides a school-based health center at a Bloomington high school, or it's in the parking lot of a Bloomington grade school and high school. Are local and that full service will model? Yeah. Yes. Schools or some not within kind of that model? The way I think about it is the full service community school provides this wheel with many spokes, and a school-based health center might be one of those spokes to that wheel. So they don't always have a school-based health center, but when they do, it's because that community identified healthcare needs as one of the needs that came out of their community needs assessment before they began their program. So a lot of them are in full service community schools. There's research that shows if you have a student body of over 500 students and you have a free and reduced lunch rate of over 50%, that a practice is sustainable in that school 5 days a week for 8 hours a day. That is hard to afford. It's hard to get to that level of use. And so we don't have a lot of school-based health centers that are practicing that way. But the Alliance is working to build some of those practices up because it's actually more sustainable the more care that you deliver. And it's better for the community too. So we have clinics that are operated 3 days a week for 2 hours a day. We have some that Minnesota Community Cares are open. Some of their clinics are open 5 days a week all day. So there's a big variety. Is it always just how does the student know? Like when you're older, when you go to the school, That's why that embeddedness and collaboration is so important. School nurses are the largest referring connection point to students to school-based health centers. So it's oftentimes when a school nurse identifies a student's needs are beyond their scope of practice, and that's when they might send them on to a school-based health center. So oftentimes those referrals are activated through school counselors and through school nurses. But there's also touch points to the community. So we often get the school board or a group of parents, a group of students involved in just promoting the availability of this service to kids. And then every school, you have to match the culture of the school that you're in. So every school building has a different means by which they notify students that they have appointments or grab them out of class or ensure that they're user friendly. Yeah.
Excellent. We have more questions, y'all. Awesome. So I think we can go ahead and get started with
I was just going to say to mention the base camp if anybody wants to follow.
Oh, Good idea. So we have, along with our community practice, we have an online format called Basecamp, where we push out a lot of information like this PowerPoint slide, and events and funding opportunities and trainings. And if you'd like to be a part of that, I can give you my card or I can take your email today. Yeah.
I think if you have like a million cards, I think everyone will want
Okay.
All right. Well, let me actually really quickly do this one big, and then could you set up for me, and then I can explain the whole process we're doing.
Yeah, we can do probably secure individual to answer the question.
Sorry, what was that?
Can the panelists sit here?
Yeah, do you want to maybe move it central? I'm gonna kind of talk about that real quick.
Okay.
Turn off the
So we can do that. Yeah, okay, we'll just. I think we can just wrap up, Jay. Why don't you finish it and then I will express. Thank you. Yeah, we can process. Meeting.
All right, everybody. So I just wanted to kind of show what a lot of what the panel discussion is going to be based on. The first thing that was really great is I'm glad you brought up the WISC model, the whole school, whole child, whole community. And then there was one more C, or no? Okay, perfect. I got it this time. So yeah, we're just going to be doing this panel discussion. One of the things we really think about a lot is, again, I feel like I've said the word equity a million times in the past 2 days. And so just looking into like how assessment, policy development, and I think that's assurance. So quality assurance and public health programs kind of works all together. And so the idea is, of course, with oral health, just like every public health program, is the goal is to make sure that people are protected and we can promote the health of people in all communities. And so let me read them off my computer. It's a little blurry right there. And so what this wheel shows is for assessment, one of the main points about it is looking at assessing and monitoring population health, as well as investigating, diagnosing, and addressing health hazards and root causes. And so I would say y'all really help us out a lot with the assessment portion of it, because of course you're giving us your data and we really appreciate it. And then we're able to actually use that information to make different policies happen, which kind of leads into the next part, which is policy development. And so through this, we also collaborate with y'all to be able to communicate to communities, because they're all community leaders, to be able to communicate the types of messages that we learn together based on what y'all have learned and the connections you've made with your communities. And then, you know, we want to also help strengthen, support, and mobilize communities and partnerships. I always kind of like to joke that one of my favorite things is linking people together. Relationship building, I think, is almost essential to program planning. And so that's exactly what we're doing here. And then, of course, creating champion policies and utilizing legal and regulatory actions, which we're MDH, so we can do a lot of that. And then for the quality assurance, it's really just about making sure that we have equitable access to care. And again, with school-based health centers, school sealant programs, that for a lot of people, I think I calculate like 45% of people, children who don't have access to healthcare in general, are able to actually get some healthcare. So I remember from your panel, just added the numbers together. And also just building a diverse and skilled workforce. Julie, some of what you talked about was having hygienists and DAs who do speak Spanish, so that you have patients who can feel heard, and can also, you know, build those relationships for themselves. And trust me, patients talk, and they will tell other people in their communities, hey, you want to go to this person. And then lastly, it's kind of just about improving innovation through evaluation, research and quality improvement, which again kind of goes back to that first step in assessment. And then just building strong organizational infrastructure for public health. And I think that's the end goal as well, is how can we build policies, find funds everywhere? How can we do all of that in order to best support these activities that are being done? Because there's only so many resources that a lot of community members have, including, you know, people who do these programs. And so I think that's kind of like what we want to do is the end goal is how can we make sure that the infrastructure is always there and sustainable in order for us to be able to actually have, you know, more essential public health programs and kind of build on what we built. So I'm going to go ahead and get started with a panel discussion if everyone's okay with that. Could you turn the projector off for me? And then, do you want me to move these chairs over here?
Yeah.
Sure. Thank you. And then these other chairs. Yeah. I think that should work. I can set all the two. This is yours? Do you also want to chair for us? I can sit on the other side. This is that. And so I'll bring my bag. Okay. So I can I'm like these. Okay. Hello? Yes. Oh, thank God it works. You need a napkin? Yeah, I'll take a laptop. Can you say something?
No.
Boop, boop, boop.
Yes.
Boop, boop.
I know.
Yeah, perfect, yeah. And so what I can do, I was hoping to be able to record this.
It's okay, we can come back for, and then there's virtual and discussion.
Awesome. And then, yeah, I will go ahead and have a seat up here and I can go ahead and start asking some questions. Again, I would absolutely welcome everybody to also ask their own questions. These are 3 people who've been working for quite some time in building those connections, so they know a lot that I don't know. So the first question I wanted to go on is on assessment. So we've learned a lot about the current landscape of oral health in Minnesota. So based on what we know now, what opportunities exist to be able to continue advancing equity using the data that we're provided with, especially as we're going to be in the last year of the grant?
You wanna go from the podium? You wanna go first?
Okay, I take a lot of pressure. So I see a lot of opportunities, especially because I'm in a space where we do a lot of legislative proposals, and we always have great support from our dental hygiene association, dental association, and a lot of partners. So I feel like we have the opportunity is partnership for us. Without that, I don't think we can even dare to dream big, and it's coming from my heart. So in terms of very tangible opportunities, one of the big opportunity that I see is with school-based health center. And recently we were able to put in a legislative proposal along with our Child and Family Health Division. And they were planning to expand the school-based health center by adding mental and behavioral health. So we added oral health to it. And the proposal was well received and we made it to the top. And I don't know what happened towards the end, that oral health was dropped. And recently our approach has been to not to go to legislators as oral health program because it's very, like right now, mouth is not part of the body. So we try to always make sure that we are embedded somewhere. And we thought this time we made it to the top. We were there, and one of the things we learned was school-based health centers are more in urban areas, and then they are co-located with middle and high school. So we thought like, okay, look at it as an opportunity. If oral health is added to this bill or like the proposal, we would be able to expand the scope of school-based health centers to now include everybody from pre-K to 12. Because Sealant and other interventions start very early. And how can you form health behind, right? In that space, and you also mentioned how students said this is only the place I could come. So I feel like for so many families and children, they don't know where to go, how to find care. So that's a big opportunity for us here. And because Shauna is here today, I felt like I wanted to really pour out my emotions that, we were dropped at the end and we did connect after that. So yeah, so for me, school-based health centers and being embedded with bigger system is a big opportunity, and that's where I think Indica was hired, and she's doing a lot of work with school nurses. So yeah, so that's from me. Shauna, you want to add to that?
Yeah, I think one interesting thing that I'm sure you've talked about for the last 2 days is that two of the biggest barriers to success in school in terms of health of students is access to glasses and dental care. And I think that's partially because of the underestimated impact of poor oral health, which is pain, nausea, tiredness, infection. And for kids, those things swiftly become part of their mental health too. And so when you can take a systemic approach to all of this, and look at the whole child, you have a place in which you can access care to the whole child, then the outcomes are obviously going to improve for health and for education. It's so obvious that it's hard to understand why it's taken so long to bring people together and not leave out parts of the body when we talk about improving things for kids. So I think we're in an exciting place right now.
I'm gonna go off of the access to care assessments. And so my personal experience has been, we work with either school nurse or school social workers because the school nurses are overworked. They have kids going in and out of their offices all the time. And so we work with school social workers a lot in some of our schools because they're also very involved in the students. I would love to see every school in Minnesota have a school-based dental partner. I mean, that would be my ideal goal. But I would love to also see, and I know it was mentioned this morning as well, is there are several just amazing organizations that provide school-based dental clinics, dental sealants. And I love that we can all get together and learn from each other. We're not in competition with each other. We never will be because there's so much need out there. And if we can all get together and work together and say, hey, this is what works great for me. This is what works great for me. This is what works great for me. I've tried that. It doesn't work for me. So let me just save you the time from doing that. So, I mean, I love hearing from Sarah. I love hearing from all these other people that are having successful organizations, doing a lot of good work. We definitely need more. We need more people going out there and working with schools. So that for me, for access and assessments, that's my dream.
And then Holly, really last quick thing.
Yeah.
I don't think I had you introduce yourself fully.
I'm sorry.
Everyone knows Holly, but I
No.
just.
They should know. They have no reason to know me. But my name is Holly Jorgensen, and I am the director and founder of Let's Smile, and we're an organization, nonprofit organization based out of Owatonna, Minnesota, and we serve a lot of Southeast Minnesota schools. We're in 27 different schools right now. And we also have our own brick and mortar clinic. And this is like super duper exciting for some of you that have known me for quite a while. We've just like built on a clinic. We're in a co-location with like the food shelf, the clothesline, transitional housing. We now have a therapy room. I know. So retired dentist that we are welcoming to our clinic and an advanced dental therapist. So we've always been about the power of prevention. For 10 years, we've had collaborative dental hygienists going out into the schools. Now we've expanded our scope and we're able to provide restorative care in Owatonna. And I did want to touch on because I keep seeing the map of Minnesota as far as like dental health shortages. And I know I keep looking at you because we got a lovely person right behind you, so I want to like make sure that you're included. In Steele County, we have 14 general dental offices. Not a single one accepts Medicaid. So when I'm looking at that map and it shows that we are not in a dental shortage, we're not in a dental shortage if you have insurance. Period. Let's smile, we are the only one that's accepting Medicaid insurance or no insurance. And for kids, there is another organization, they're kind of more like the medical base too, but they work on volunteers and they have a really hard time getting volunteers because dental professionals work all day in their own jobs and they're far behind. And so they're retired, and so working with volunteers is really, really hard. And so accessibility is extremely limited without, and we mostly see adults, we see kids. So I love their initiative. I just know from the feedback from the parents that we get that they don't get it. And so when you're looking at the map of Steele County and where all of those CC schools, and you're seeing the map and you're saying, oh, they don't have a dental shortage. You're right. We have a dental shortage of MA providers. So I don't know if we can change that or what we can do about that, because when people look at that, or like when I'm writing grants and they see we're not in a dental shortage area. We're not. But yet free and reduced lunch, we're at like 40, some of our schools in Steele County are 38-40% of free and reduced lunch kids. They have nowhere to go in Steele County. Nowhere to go unless Let's Smile is there. So I just want to see that map updated for all counties. I think that map should reflect how many are accepting MA rather than, yeah, you got dentist, good for you, good job. But you can't get in.
And I will say too, with the only thing with that one is actually counties have to apply for that designation.
Okay.
So if they don't update it, and I think we kind of talked a bit about it, but it's like if those maps aren't updated, then people won't know exactly what the shortage looks like.
But we have I mean, but
Yeah, you experience it.
Yeah, so then we do have dentists. So then how do I like say, so is there a difference then about like?
Well, maybe they're counting all the services you provide so that you're making it look like there's good services in that county.
I don't know. That's just my 2 cents.
I think this is more like our parking lot. I think.
Yeah, I'm
Yeah.
sorry.
No, you're totally
This
cool.
is not like in our community of practice. I think
Yeah.
we could bring back those folks who are actually
Yeah.
hands-on, and then
Yeah.
the map is going to get updated.
Yeah, we can kind of like look over the map and then kind of identify what areas are the map, because it also will tell you how many offices there are based on what the county says. But yeah, so we can go ahead and do that, and that'll be like a great community of practice like question, because we already talked about that.
Yeah, thank you.
Or like you and me did. And so again, like a huge part of working with schools also involves trust. How do we build authentic school dental provider partnerships as well? And I know you've kind of mentioned it a bit, Shauna, but yeah, it's just kind of like how are we able to build those relationships and also keep them sustainable over time?
It's interesting. I think this kind of relates to the question about the quagmire we're in of where are there free services? Where are there services available to those on Medicaid? Where are there services available to those who can pay for those services? And where are there services in all of those categories that are provided in schools? And one thing I think that's of concern in terms of building relationships is that we do have providers throughout the state of dental services
that are provided to, there's instances where they're provided in a school to those who can't afford it.
Mm-hmm.
But it is exclusive, even though it's in a public school.
Yep.
And so those initiatives create the risk of increasing disparities among students. Because they're continuing to provide for the kids who have access, rather and then continuing to leave behind the kids at home. So I think building, one of the reasons that in the new legislation that we passed for the definition of a school-based health center, which is, there's no enforcement for this in the state, right? Unless right now we're in this great position that the Department of Health was able to pass this legislation with a grant program attached. And so that means they can write it into their RFP that there are eligibility requirements if you're going to get this funding as a school district or a sponsoring healthcare organization or a dental program. And we can require, if they're going to get that money, that they turn no child away for their ability to pay, or they don't use collections, or they provide it here to all. And that's on them. The Department of Health doesn't have to figure out how they're going to do that. They can just say, you can have money if you figure out a solution to that. And it might be the Robert Wood Johnson Foundation, or it might be Pooling Risk. But we have to find more and more, in this case, dental providers who are willing to take that step to find a way to provide care for all. And so that piece of the legislation was very intentional this time to say, so to give schools an opportunity to say, you can provide care in our schools, but you have to provide to all the kids in our schools. If you want to be our partner, you get to know how to do that. And we've already seen one example in Moorhead, Minnesota, where we're choosing between healthcare providers that included dental, and they really needed a way to select the provider that would use a sliding scale, and that legislation gave them that ability to say, we're going to follow these rules because we want to fit this definition of school-based care. So I'm sorry you can't be part of this initiative, which is great.
So any other?
I can add barriers to what we see from dental perspective. And technically, your question originally was about building that trust. And so I've been in this position for over 6 years now. And what we've been hearing is we really want to promote collaborative practice dental hygienists and maximize their use, right? But over the times, what we have heard is sometimes there are bigger partners who are well established there in more schools. Then there might be hygienists like someone who wants to, have a new agreement with a dentist and be on their own, not so independent, but still be in a space where they are partnering with a dentist for clinical supervision, but is doing a lot of their own work and keep all those administrative barriers aside. So they may not feel more trusted or endorsed to go into the school compared to bigger partners, right? And for us, all partners are the same, and we love to see more dental hygienists entering into collaborative agreement, and here has been such an advocate for that. So in order for us to do that and build that trust, not individual, but as state, to do that at a system level, we started creating those posters where whether it's a bigger program or a smaller program, as long as you are under Sealant Minnesota, and this is not an authority, but really trying to, and Orland program is very small, right? But we also have MDH as a branding with us. That's what we can offer. And Ethical towards the end, is going to talk a lot about innovative things that can help us be within a space where we feel comfortable endorsing certain programs, not because we love one partner over the other, but there are certain things that I can keep to, and I'd like to talk more about that. If you need certain criteria, we can, have you under the umbrella. So that was one way that we were thinking of helping programs have trust with the schools, because we are not working with families and at the family level, the education materials are also different languages. That's the thing. Just one more comment and then So going back to the integration of dental in the school-based health program, when I was writing the proposal, one thing that we were not sure is how our dental hygienist is going to be part of the system if this proposal goes through. Because unless they have the ability to bill, which means they have to either sell on the nonprofit or be affiliated with them, they would not be able to be picked and they can never be a staff at this school-based health center. They can be hired by the school or it can't just be one hygienist trying to do this work. It has to, and we also found out that there are existing health systems who have contracts with the school to do general medical. So it has to be through them because there are also contracts given to general health systems. So we ran into those issues when we were writing the grants. Just wanted to let you know that if I did see the proposals that are removing these barriers, I think it's good, but those were the things we encountered on our side. Yeah.
And then, so Holly,
Yeah.
since you were the one who started your whole everything as a collaborative practice hygienist, how did you start to build those relationships?
So the best way that I knew how to build relationships within the schools is who turns away a free oral health pep rally for the students? Nobody. So all you have to do is just start contacting teachers and saying, hey, would you, because they all talk about like they all have like dental unit. Would you like a dental hygienist to come in and talk to your students about oral health? Yes, please. So in the 10 years, the first year that in 2013, I went in and I did, like I said, it was a lot of calling the teachers, seeing who wanted it. Usually kindergarten, first grade, second grade, and fifth grade high schoolers because they have health classes, and put on just dynamic oral health presentations that have now morphed into oral health pep rallies. Just really motivating children. I mean, they've all heard brush and floss, that's boring, blah, blah, blah. So, but why do you need to brush and floss? How do you brush and floss? What's going to happen to me if I don't brush and floss? So really talking on their level. So I've created curriculum per age appropriate and really just saying with the little kiddos, I mean, we have cheers and chants and we are like going at it and we're having so much fun. Like the pep rallies like usually last about a half hour now. And every single student gets a new toothbrush, toothpaste, floss. They have now seen my face in the school. Okay, that's how you build trust. They have now know that I am a true, passionate oral health advocate. I haven't even touched a kid clinically yet, but they know that I care about their dental health of their kids. So, and I'm giving them tools, and it's for all of the children. It's the whole general. Our pep rallies are for everybody, and so. So getting my face into the school made it so much easier. Now I'm asking the principal, who's the best person for me to contact? Would you be interested in a school-based dental clinic by chance? And they're like, well, what's that? And then I have they've already seen me, I've already met them, I've already met the kids, and I'm not going in there blind. I either get assigned to the school's nurse or the social worker, like I said. We sit down, we talk, we discuss. I have proposals now that I send to every school, and I let them know this is no cost to the school. This is no charge to your low-income families. We're here. I bring in all the supplies. I bring in all the equipment. I bring in the staff. But it doesn't happen unless you have a relationship with the school first. That's what gets you into schools. And so, and I still do the pep rallies, and I still do that because also I'm building trust with the kids, right? So we're having fun with the pep rallies. They've seen the face. They know when they come into the school clinic, and I'm sitting there waiting for them. They've seen me, and we've had a happy experience together. That fear's gone. Yeah, it is just they're like, yay! And we have kids that want to sign up. We only serve low-income families, But I have kids that have dental insurance and they want to be a part of our program. I'm like, sorry, we have insurance. That's the only time that they, I don't know, maybe I'm just weird, but it's like I get to say yes to the Medicaid patients where they always hear no. get to say no to the thing. That's really mean, isn't it? But I get to say yes to the Medicaid patients. And I'm like, yes, I'm giving you service. Trust. When I'm in Walmart or at the grocery store and a kid comes running up to me in the aisle and is like, oh, I brushed my teeth today. And we do the happy dance. And the parents looking at me going, who the heck are you? And the kid's like, well, she's the smile fairy. And she comes into our school. And then the parents are like, oh my gosh, you're the one that gave them the toothbrush in the class. Our kid is brushing their teeth every day now. You know, I mean, I
So
get
like-
so much feedback from parents from these pep rallies that the minute my flyer goes out to the schools that we're hosting a school-based dental clinic, sign up, sign up, sign up, sign up, sign up, because they already know our name, they already know what we're about.
And so,
Establishes trust and relationships.
yeah. And so it kind of sounds like from what all three of you have said is some of the best practices go from everywhere from overall the policy like dimension and having requirements of if you want to be able to have this for your schools, we also need X, Y, and Z from you. And then also hearing that you want to connect with the kids because if they don't know you, they're less likely to want to open their mouth up for you, you know? Yeah. Yeah.
That's walking off the street, you know?
Yeah.
So they're like,
And I think once like parents know that so I think like once parents kind of know that their kids feel safe with you, I think it also gives them more of an incentive to seek other care. And so I think that's one thing that I'm hearing. And so I actually wanted to ask another question too. In terms of let me see. How can we also continue to build more sustainable infrastructure for school sealant programs? Because again, we talked about how going into communities, you really need to have honestly a face in the community and they have to know you. And so what else can kind of aid in sustainability? And this can also be a question, y'all, if you have a thought, please feel free to answer as well. Oh, yeah. Yes. How can you keep things running?
Thank you.
I think I'll just start at the highest level that we have recently seen the legislature leading in a little bit more. They did specifically leave out oral health this year, but now we have a policy agenda for the next year of where we want to go. And the health department's policy division is really rallying behind that. So I think there are good things to come and soon. We have opportunities, just a few opportunities. We have opportunities at the CMS level to bill for some services that are provided in schools, to bill Medicaid for those services that are underutilized right now. So that is an area that DHS is working on with MDE and NH as well. And I would say, I think it is, in terms of sustainability, I think just knowing the landscape is really important. I think one of the things that Minnesota is, that puts Minnesotan children at risk is that we have a gross underestimation of the risk in terms of oral health right now. And it's unfortunately partially because sometimes care is given to kids for free, and if it's not documented, if it doesn't go through Medicaid and it's pro bono work, it's never reported that that service was necessary. And so we underestimated oral health risk among young people in Minnesota. And so I think all of these efforts will help us. The SEAL program is a wonderful way to bring in those people that it brings them into an official position with the Department of Health, and it allows them that easy reporting mechanism so that we know where they are, we know, and not so much, we don't need to know what they're doing, we need to know who needed what they were doing. And so it's giving us a better idea of the need so that we can really get to work at figuring out then how to pay for it. And I think when all of these things start happening and when the systems start, when we work well together, those programs
that are committed to Medicaid patients and those who don't have the ability to pay. I think it will, this might be a little Starry-Eyed Crusader of me, but I think it will start to bring in, I think it will get the attention of those who have started to refuse to pay. And bring in more, a stronger sense of if you're going to provide dental care to our children, you can find a way to provide it all.
And it's so interesting that Shauna brings out something that our dental hygiene colleagues have been struggling. I'm just so amazed that Shauna said we underestimate the risk of young children. And the reason why we are underestimating the risk is because our dental hygienist friends are not reimbursed for the risk assessment that they go through.
Yeah.
So that way the work is happening, and dental hygienists might be doing amazing work to connect kids to access, and that's dental public health. Whether dental office is accepting patients or not, that's another space, right? Our role as dental public health professional is to make sure that you go to the risk assessment, basically and do preventive work and do the best you can by doing a warm handoff. And that's exactly what the dental public health scope is. Beyond that, once you do the warm handoff, it's really a lot of things with the dental office policies and other things. Right now, I'm just thinking how we collect those open mouth assessments amongst our third graders and see 50% of our children already have cavities because we are not focusing on the risk. We don't have the common risk factor approach, right? You can screen kids for hearing, vision, everything when they enter kindergarten. And we've been trying here to add that policy to add again mouth back in the body. And nobody is even thinking about it because they are underestimating the risk. And I'm going to package next proposal with this tagline, we are underestimating the risk because we are not allowed to even be compensated for the risk, right? Or and earlier I used to think we should get legislative money or state money and not CDC money and problem would be fixed. But now I feel like it should not be even dependent on any funding. It should be a system where we have reimbursement done in a way that it's sustainable in itself.
Can I say something? Because when you look at the whole child, and it's not only the risk of that tooth, and so you look at the whole child, it might be behavioral risk or speech risk. I'm thinking of some little children we saw who had extreme behavior problems, and it was a really hard time for this preschool. And then, meanwhile, we went in there and we saw that they needed to be seen, and we referred them for care, and they got care. And then the behavior became perfect, and then another child who had a behavior problem and a speech problem. And after he got his teeth fixed, the school no longer had the behavior plan or the speech therapy plan. So you've saved money. You've saved a lot of money in other arenas that we're not also taking about. We're not also taking that into account.
Yeah. The only gap in the whole space, something that I know from Dr. Linda is that risk assessments are generally not reimbursable even in a medical setting. So when you're looking at Medicaid, Medicare, public assistance phase for reimbursement, risk assessment most of the time is a tool that facilitates the diagnosis, and there's already a code there. So that is the reason why we were not able to say, in medical, you have to do risk assessment and it's reimbursable. So we could play around with that space, but in dental it's unique, right? Because unless you are looking at the risk, you cannot prevent cavities. And we have different models where you can predict the risk of someone having new cavities. So I feel like with Shauna's perspective, we can use your ideas in our next proposal to frame it as underestimation of the risk, which I think we have packaged it that way.
Yeah.
So thank you, Shauna.
Such bright ideas. So first of all, I'm super thankful for people like you that are in legislation. I mean, thank you so much. You're making changes so that people that are out on the ground doing the work, we can benefit from your changes. So thank you, that you're making a huge difference. How we keep running, how we're able, because that was your main question, right? How do you keep going?
funding, how do we fund it, right? So we need to have a diverse, very diverse, grant writing. You know, not only do we get grants from, thankfully, thank you very much, the Minnesota Department of Health, through the Sealant grants, everything, but we have to go write grants to people that don't have any dental knowledge whatsoever. You know, we get United Way grant writing, which has been, we've been a partner with the United Way of Steele County for 8 years now. They had no clue that the mouth is a part of the body. So that is all in our grant proposal. We are now, since we're partners with the United Way, they help us get that word out into the community. We've got to educate our community. We get grant funding from Auto Grammar Trust. Okay, they're phenomenal. Are they a dental? Do they have any dental knowledge? No. So let's educate them. We get grant funding from many other sources that are not dentally related. We also get a lot of community, like in our community, they have different grants. Like I said, United Way is a big part of it. We get a lot of individual donors now. We've been building that up. People in our community, because they've seen the results of what we've done. Trust. It goes back to the trust. It goes back to, we have an annual fundraiser where people come in, and I'm gonna invite all of you, I really hope I see you this year. It's in November, okay, it's in November, it's the Friday before Thanksgiving, and it's called Let's Smile, Be One Laugh. You know, there. And it's comedy night, because we love smiling and we love laughing. We invite our public, we invite the whole community to come to raise money for our underserved children. Bam, we just told them that the need is in our community. Okay, so it's kind of twofold. So not only are we promoting our services for the people that need our services, but we're also letting people know in our community, hey, this is a really huge issue in our community. They don't know. You know, why would they know? They're not sitting in here with us. They're going to their own dentist. They have no problems. They have private insurance. Let's educate our community. So, like at our event, you'll see a slideshow going on while people are doing social hour, while they're enjoying their hors d'oeuvres and their drinks, and they're having fun talking. We have the stats up there. We want people to know what are the stats of our community and our lack of dental care access. How many kids are we seeing that would not have been seen? We want them to see the pictures of those cavities, because they don't even know what that looks like, you know. And so how do we keep going? We engage our community. We want them to be as passionate as we are. We want them to know what's going on. They help find us because of the fact that they can have an impact, and they can also be an oral health advocate, and they can join us in the fight. And that's what we do. So thank you for doing the legislative part. So thank you for doing the legislative part, because I can't do that. And that is not my strength by any means. So I appreciate the people that have that strength. Because of you, I get to go do what I love to do. So thank you so much for doing that.
Yeah. That was a really beautiful way you said it too, is it really kind of comes from us. I think a lot of times when we talk about education and outreach, we're thinking just of the people who like need the services. Like, let's teach you about, you know, oral health. Let's do this. But I think sometimes what we miss is that there's all these huge players and rich people who have a lot of money, but just don't know because they haven't been impacted. They haven't seen it. They're not in our clinics. So it's really also about reaching out to them. The only difficult thing is sometimes with like private donations, sometimes those funds may end up being redirected elsewhere. And I think that's where we come in with government, with regulation, with all of that, and our partnerships with other people throughout the, honestly, country, in being able to do this work and being able to, hopefully we can do the underground background work so that people can actually show up. Yeah. So that's my goal.
The reason that it's important to do the legislative work is because I would say this actually.
Because nobody else will do it, so thank you.
the more legislative work that we do, the more time you can spend
Yes, that's what I'm saying to you.
working on kids' teeth and doing clinical interventions and going to pep rallies and making friends with the students in your community. Because personally, and I think our organization, our position on this is that we have some level of resentment for the fact that you have to plan a fundraiser. And that you have to, writing grants,
It's a lot of my time, yeah.
it's very costly when you think about the hours that go into doing that. And so whatever we can do to have people like you in your work spending most of your time at the highest level of your training
Yes.
and doing interventions with kids, then we're all doing better. And so that's partially why we do the legislative work in the state planning. And I will say the other thing that comes to mind for me, and this I think is perhaps a parking lot item too, is that so many of the people that you're talking about who are either receiving care or that are coming to your fundraisers are people that are paying, even if it's partial pay for a miniature product, they're paying for healthcare insurance. And we know that dental care has oral healthcare has a far greater impact on health outcomes in adulthood than we give it credit. And so your work is actually subsidizing the costs for healthcare insurance companies because you're making the people that they are insuring, they're less costly adults. And so I think we need to ask them to invest more also in children's dental care.
So it's called that smile.
And the interesting thing with what you just brought up, with kind of putting it, those healthcare savings that insurance companies have, how we can utilize that. We've even had like Blue Cross Blue Shield have regional coordinators. We've talked about it a little bit, and I want to send, of course, more information because people were interested, but they help kind of coordinate the care of people by partnering with local agencies and being able to help with transportation, help with all of these things. But part of what makes that possible, in addition to their foundations, is really just the fact that they do save a lot on ER services, like things like that. And now they're able to put back in the community. So it's also, how can we keep that going and how can we continue that ask and again make it somehow mandatory.
I think what Shauna said, what Shauna was trying to say about me is that sometimes we have the grants coming in and we are doing product management or other work, but not really reporting it to the company DHS or whatever. So that means the good work is being done, but as a state, we do not have data on the extent of this goodness. Then what happens is that we're not able to show, and I know, Claire, like you could help me, say this correctly. I think there is already a code that dental hygienists could use to let DHS know about the risk assessments they are doing. Right now, we're trying to do a pilot to see if that can, do something. Right now, I don't think people are doing that because it's more administrative work to do because there's no reimbursement. But on the other side of it, if you're not doing it, there's no way we estimate risk.
Yeah, so we do put that in every single claim for MA that we do. It's the risk. It's a basic screening.
Yeah.
So they're seeing that we're doing that, so it's being recorded. It's written off every single patient because it's not reimbursed. So they are seeing that we're providing that, but it's a write-off.
We're going to check that data.
Yeah. We actually had the same thing over at my clinic where we always wrote off Carrie's risk assessments, nutritional counseling, and oral hygiene instructions, just because it wasn't part of the PPS rate that we got from Medicaid in Arizona. So it's not great to hear that it's like followed me. But it's also really great when you talk about, how we can kind of minimize those administrative tasks that people have to do. I think that's a really great practice in terms of how we can mobilize our like allied dental workforce. And so I'm kind of thinking like, how can we help other people who want to do collaborative work? How can we, like, on again, like the legislative, government, et cetera side, like what kind of best practices can we use in order to make that work doable?
I'm just gonna throw this out there just because I'm the grant writer of the organization. Please make those grants so much simpler. I mean, I'm being very serious.
No, that's, yeah.
We applied, so Let's Smile, we actually applied to the grant through the Minnesota Department of Health about a clinical grant because we were expanding our clinic last year. We had that building, we got the 2 new rooms, we're getting new employees, the dentist, therapist, assistant, I spent so much time and energy. I don't send out a grant unless I have 10 proofreaders minimum. Because in my head, I know what I want to say, and it's all dental language land. But so I want to make sure that people are reading what I'm reading because I'm like, okay, I said that, but then I'll say the exact same thing over here, I'll say the same thing. So I have proofreaders. All of us spent so much time and energy on it, and we got denied. We were denied. And so we're like, well, I guess we're not hiring a dental therapist this year because we didn't have the funds. So we had to now put it outside for this next coming year. We're talking with a dental therapist right now and busy writing another grant for Arnold Bremer. Tell you what, their grant application is maybe 5% of the Minnesota Department of Health. Yes. So when I see the Minnesota Department of Health grant, I freak out because it's like you have instructions. I mean, I'm sorry to say this, but there's instructions and there's instructions about the instructions, and then here's an answer, and then here's this one question has 10 things that you need to answer, and then this is here, and then this is here, and this is here. And I could be in a school, I could be taking care of kids, I could be doing this. And instead, I spend so much time and energy filling out a grant, right? And you guys know who we are now because we've been writing grants for so many years that I'm like, well, you know who we are. I send you my data. Does that count for anything? Nope.
Call us out.
I'm frustrated.
I do a disclosure here.
Yeah.
This is not our grant, but it's one of the programs within India. And the reason why we make it like that is those are legislative requirements that each program has to collect information certain way. But I will tell you that MDH has changed over the years, and there is a big focus on community engagement. How do we bring them to the table, equity, and at least in our level program, we never score anyone based on their you remember grammar, English, anything like that. And we even receive grants, especially for our water filtration, where people are writing grants, and we receive it in mail, so it's a handwritten.
Yeah.
And sometimes it's not even the grant managers doing it. It could be like an water operator putting in the application. So it's really like you would write really like a book, not really a postcard, but it's very simple. But over the time, I think MDH has realized that these processes are creating more inequity. Because more seasoned people who have the ability to write grants are getting the grants, and people who need the grants, they do not have ability to write grants. So there is a big shift that at least I've seen. I don't think we are there yet that we can celebrate. So for the time we still have to deal with it, but there are changes happening, and there are committees looking at the grants and making sure that it's less administratively burdensome for our people. But we still have to put out grants.
Right. And it's, as a grant reviewer, it's very obvious the grant applicants who have grant writers.